Welcome. Good to see you all. Welcome to today's research series session. So as a reminder, this curriculum is co-sponsored by the Office of Continuing Professional Development and Dr. Farrell's office, the Office of Research and Development. And we operate across both the hospital system and the medical school, which is why you'll notice that we have made a concerted effort to increasingly include expert presenters and representatives from both Carilion and Virginia Tech, Carilion and Virginia Tech. So while many of the concepts that we discussed throughout this series will apply to individuals at RUC or elsewhere, wherever else, this is not a series for which we will focus on the resources beyond Carilion and Virginia Tech, Carilion. Okay. In today's session, we're going to focus on collaborating with your biostatistician at all stages of your research study. They are fabulous. I know that they will probably recommend during this session to start early. That's usually the easiest, but they are there with you along the whole way. So our expert presenters today are Dr. Tonja Locklear and Dr. Monica Ahrens. And Dr. Locklear is a data science engineer biostatistician 3 with the health analytics team with Carilion Clinic. And Dr. Ahrens is a research scientist with the Center of Biostatistics and Health Data Science in the Department of Statistics at Virginia Tech. I don't want to take any more of their time, so I'm going to turn it over to them now. Thank you so much for being here, Tonja and Monica.
Thank you.
Okay. Just to remind you all of our learning objectives, we left them in here, and hopefully you can refer back to them later to remind yourself what the heck we talked about for an hour today. So today our goal is to tell you about the statistical analysis resources you have available to you at Tech and at Carilion. So Tonja, do you want to introduce HART first?
Sure. Yeah, so I work for the Health Analytics Research Team, also known as HART, with Carilion, and it's directed by Maddie Tenzer, and we are technically employees of Carilion Clinic, and then that is our email address. So that email address will go to a set group of people, and then they can filter it out to the people that it might pertain to. But that's the email address to use to reach us.
Yes, and I work for the Center for Biostatistics and Health Data Science, and we're physically located in R4 on Riverside Circle, so very close to the hospital here in Roanoke. Our director is Dr. Alex Hanlon, and Virginia Tech Department of Statistics does employ us, and we work primarily with tech employees, but that doesn't mean we can't work kind of beyond that, and we're always working to kind of expand. For this email address is the same, biostats@vt.edu. will go come to everyone in the center, and then we'll figure out who best can answer your inquiry. And then also our website has a lot of good information.
So I'll start with just kind of giving you a basic description of our team. I won't read through all of this, but we have our team has grown over the last few years. So we have 20 people on the team, and we give support from beginning to end, which Monica's going to tell you they do the exact same thing, because that's basically the reason why we're here in having this conversation. We want you to know that we are available for the whole time. We have a lot of people that have worked for Carilion for 20, 30 some years. We have some that are new. So we're a diverse group of people, but we can support you in a lot of different areas like the research informatics and biostatistics and so forth. We are a part of the CTSA grant and the NIH grant. So there's a lot of different things that are helping support, or we are using to help support Carilion. And we also are now helping with the app development process at the innovation department as well. We do have virtual office hours that are on Tuesdays from 10 a.m. to noon. If that picks up, that might change to add a different day, but we do have a link to that. And I think that we have another document that has another link on it as well. It's the same link, but I think it's listed in 2 different places. Oh, I'm sorry. So our end-to-end research support. All right. So in the design stage, we want you to come and work with us as soon as you possibly have an interest or an idea. We will help you walk through the study design support for that, biostatistical consult. The office hours that we've had, I've had people drop in and ask questions about, is this feasible? Is this, what would we need to do to collect this data? Is this data available in Epic? Is it going to be something that's like a chart review? There was a lot of questions that people have at the very beginning that we can maybe answer at the beginning without having to wait until it goes into the IRB. And a lot of times, if you get a lot of it answered at the beginning, then that helps the IRB move through a lot faster. We'll talk to you about power analysis and the feasibility. We can use our program Trinetics that allows us to use ICD-10 codes to be able to determine whether or not there's enough data or how many people we think would fit into this particular program. So there's a lot of different things that we do on the design end, and we can help you with Epic research access for your members, and we also support clinical trials. For the data piece, that's actually where we probably have a lot of our time built into that as well, because we have, we can pull data directly from Epic. And because of that, it's part of our job. And so because of that, we can help with, we can see the identified data, even if you can't see the identified data and you need a de-identified data set. That's part of what we do. So we would help pull the data for you, Trinetics re-identification process as well. We use data from registries. I've worked with the trauma registry and also some of the other cancer types of registries that we have available. So there's a lot of different things that we can do where the data pool is concerned. And then also we have REDCap. So that allows us to work with you on building surveys or managing the data, keep it in a secure environment. So that way it doesn't get shared by accident. And then we also have share drives available, but we recently started with a Spark environment, which is our secure cloud-based storage. And in that Spark environment, we can have people that collaborate with you on projects have access to it as well. And then inside of that, we have SAS Studio, we have R, we have Python, we have a lot of in vivo. Those are different things that are inside of that Spark environment that you would have access to using if you wanted to try to analyze some data yourselves, or if there's someone on your team that has some experience with it, we do have that available. We also work with data science methodologies in the analysis. We walk you through quantitative, qualitative analysis, and in vivo is the one that's basically for the qualitative pieces. And then we would help you by either helping you with the statistics or doing the statistics and then sharing the information with you. And then we work on doing the posters, manuscripts, images, all those different things to help you go through the whole process. So that's everything that we would do, which again is end-to-end support. And it's really not much different than what Monica's getting ready to share with you as well, because we both kind of do the same types of things in the process.
Yes, so I'm going to talk about what we do here at the Center for Biostatistics, and specifically two different categories. Long-term collaboration, which I'll start with, and then short-term consultation as well. So long-term collaboration, we define as a biostatistician serving as a collaborator in an academic position who works with an investigator to do their research from conception all the way through dissemination. So really being a part of the team instead of maybe just advising the team. So this includes the statistical analysis plan, helping you create a grant. If you plan and want to apply to a NIH grant, we can help you walk through that process specifically in the statistical analysis sections that are required for NIH grants, and help you really refine your research strategy there. And so these long-term collaborations typically last multiple years, especially with NIH grants. And how we would work is to provide you kind of analytical and data management support. So we also develop REDCap databases similar to the HEART team. We really like to meet with our collaborators often to keep up with exactly how the project is going. It allows us to stop something from going wrong if we see something happening. Continuing to put out new proposals if you want to continue your research, and then also providing interim reports if it is a clinical trial that requires something like that. And then finally, we of course help with manuscript writing, and then conference preparation, including writing abstracts, helping you with your posters, etc. And then for short-term consultation, we also have what we call drop-in hours or walk-in or office hours, however you want to call it, on Mondays from 10 a.m. to 2 p.m. And during that time, you would see me and get to work with me. And then Wednesdays from 3 to 7 p.m. where you would work with a couple of my colleagues. And there is an in-person option. Like I said, we're over here in 4 Riverside on the first floor, and I'm always sitting here excited for people to come visit me. So if you have a question, you can pop over during one of these times. If it's regular working hours, I do go home at 5 p.m. so that I can hug my dog. But otherwise, I am always here and always really excited to help. And typically in these short-term consultations, how we kind of define it is by a relatively short period of time that we're working with you. So a question that can maybe be answered in 30 minutes up to an hour. So you might be conducting your research and feel really confident about it, but then have like one tiny question that you're like, the statisticians can help, and you can drop in and utilize that service really as often as you need to as you're trying to conduct your analyses and things. Okay, so now I think we've kind of really lightly brushed on all of the things we do, but let's take a deep dive into, we've told you we want you to use us throughout a whole research project, but why? And we'll really explain ourselves there. So I'll start with stage 1, which is planning. So a big portion of planning is power and sample size calculation. So if you are submitting a grant to the NIH, they require power calculation. And then I believe the IRB at Carillion really wants you to conduct one as well. And the reason why power and sample size calculations are so important is that they prove to like a funder that if you spend all of their money doing a study, you have a really good chance of actually finding an outcome at the end. So the example I like to use is blood pressure medication, because my statistical and non-medical brain can kind of grasp blood pressure. So say you want to compare 2 blood pressure medications, we will help you find out how many subjects you need to enroll to take each medication to find a statistically significant difference, if there's truly one. And that is super important, like I mentioned, because the funding agency wants to know what you're spending their money on and if it's worthwhile. So there's always this balance of, having enough patients that you get statistical significance, but not too many that you break the budget or that they feel like you're spending money needlessly. And then also there's a balance with, blood pressure is a bad example, but if you're working with like a very rare disease that maybe only a few people in the Roanoke Valley area have, we have to take that into consideration as well. So things that kind of go into a sample size estimation and what statisticians are always thinking about as we have these discussions are, what is your research question? Because the way you're asking your research question or how you're quantifying it matters in how we calculate power. What's your desired level of power and what's your desired statistical significance level? And that's the alpha less than, or the p less than 0.05 that people typically go with. And then power, we're all typically aiming for 80% power. And that means that if there truly is a difference that you're trying to detect, it's truly there, you have 80% chance of finding that difference. And then a clinically relevant effect size is very important as well. So if you think about blood pressure medication, if you prove that one medication lowers blood pressure by 1 point, is that clinically significant, or is that patient still at like the same risk of things as they were at 1 point higher? So that might not be a clinically relevant value. So we want to find that sweet spot where it's the smallest possible clinically relevant value. And that's what we really like to create power on. And then the last thing is variability. Blood pressure, I have know nothing about it. So I don't know how variable it is. So it'd come to, or when you were having a meeting about sample size, we would need to know how variable it is, because the more variability we have in a variable, I use that word too many times, the more sample size we need to power properly. So those are kind of the things we're always thinking of as statisticians when we're trying to go through a power calculation.
Yeah, and I'm going to jump in if you don't
Yeah.
mind for a
Yes,
second,
please.
Monica. In the one of the things that I just wanted to say too is that we when we're talking with you, a lot of times we'll ask you questions about your research question, and maybe you have considered trying to analyze data a specific way, like that's how you thought about it, but it may be in the conversations that we have with you, it may be that we might ask you, well, have you considered analyzing it? I mean, collecting the data a different way. Is it numeric? Is it going to be a yes, no question? Those types of things. And I think it's important from the very beginning that we understand that when we're having questions with you, that those questions are to help us get a better feel for your study. And especially since we're not clinical, myself at all, then I have to ask a lot of different questions to make sure that I'm addressing what you're trying to get your final research question to be. And so there's a little bit of a discussion that goes back and forth in addition to that power and sample size questions that we're trying to help you narrow down your project in the best way possible. And so we're not trying to push back specifically, but we're trying to gather information to help you with your research study.
Thank you for that. That's very important to add, yes. So I'll briefly talk about a statistical analysis plan. Our center uses them as a way to make sure, for two reasons. One, to make sure the research is focused, because I think everyone that does research is very excited about everything, and then we can kind of go crazy and get off track. So the statistical analysis plan really writes everything out so that we don't do that, because I'm guilty of it. I think a lot of us that do research, that happens to us. And then the other thing is, at the center, and I believe at Heart as well, we kind of all work together. So we might have to have an instance where I start a project and then my colleague takes it over. And a statistical analysis plan allows us to track everything we've done to keep a really, really good, thoroughly detailed information about what happened, so that anyone can read it and know, reproduce exactly what happened. So what goes into a statistical analysis plan, the background info of the research study. And this is, again, Tonja and I have both mentioned, we're not clinicians. So it's always super nice when we start working with someone, we get like the basic papers about the things, and we can read and grasp a little bit about what's going on. And we'll put that into the statistical analysis plan to remind ourselves over and over and over again what the clinical relevance is and what's going on in the science. And then we'll write in the design and the framework so that, again, we remember the plan that we started with, and then inclusion and exclusion criteria for study participants, which is important. When we clean data, we'll double check that everyone should be included in your study that's in the data set. So this really helps us stay on track, make sure we don't miss details, and just keep everything moving forward in as organized as a manner as you can. Oops.
So what's going to drive this statistical analysis plan are a variety of things. And so one of them is, this first step would be our study aims and study design, kind of like what we're already talking about. What is it that are you looking for your analysis? Or what is it that you're looking for to as your research question? And then how can we get to analyze that to make sure that we're answering it? The feasibility, there's some things that we need to avoid, and that's feasibility. So I have worked with people before, and I would ask them about how many people do you expect there to be if you were to analyze this data? How many are we expecting? And then they may come back and say, well, I believe that we see about 20 a week. And I'm like, okay, so we estimate about how much that is. But the problem is that sometimes we're off. Sometimes we haven't taken into consideration other things. Sometimes we just maybe are over, like we think that we see that many, but we actually don't. So the feasibility is a very important process. And that's one of the things that we use Trinetics for on our side for the data, because we can actually pull the data in with like an ICD-10 code and kind of filter it a little bit and give you a better idea of, okay, well, this is saying that in the last, 3 months, this is how many people we have. And that gives us a better idea of, are we going to be able to do this in a reasonable amount of time, or how long is it going to take us to actually collect the data that we need? Also, does the data answer the research question? So again, that's the discussion that we have with you. Again, not as a pushback, but just if you want this answer and you want to address it with this particular question, then the data that you need to collect is probably not going to do that, or is going to do that, or that it's just a discussion back and forth to help us make sure that we're getting the best data to answer the question that you're looking for. And then the sample sizes, are there enough subjects to power the analysis? Just like Monica was mentioning, it's very important because you don't want to spend all of your time now getting a non-statistically significant result. Is okay, because that's part of research as well, and those things happen, and it doesn't mean you did something bad, but we need to be able to make sure that we have checked off all the boxes and that our study didn't find a statistical significantly different result. I'm going to say that again, because there really wasn't one there, and not because we weren't powered enough to find it. So that's one of the things, those are some of the things that we have to address when we're looking at the SAP and how we're going to mold your project so that we can make sure that we're answering all these different questions. Okay, so in step one, we have the study aim and the study design. This is just really what are the aims of the project, making sure that, again, it's pointing you directly to the target that you want and not maybe someplace else. And also, I believe sometimes when people are working on it, they're so close to it sometimes that maybe they don't necessarily see one way or the other, or see a different avenue. And that's why those discussions are important, and also why we suggest talking to us from the beginning. I have had multiple times when people have come in and said, here's my data, and I would like for you to help me analyze it. And then I have to explain to them that it's not going to actually address the question that they have. So that happens from time to time. We hope that it won't, but we will help you go through it if possible. And then as you go through the study design, we also do a lot of retrospective studies because we have such a huge database of data from our electronic health records. And there isn't anything wrong with the retrospective analysis. It just needs to make sure that we are addressing retrospective analyses in a way that's going to be beneficial and that's going to provide the best information so that you can get your data published later on, and that you understand what the data is telling us. So there are a lot of different things that can be done. We have survey analyses, but all of this has to be designed from the beginning. And then once you design it, then we know that we're going in the right track. We don't want to wait until the end and try to add things at the last minute, or realize that our data is not doing what we want it to do. So those things are all the first step in the process. The next thing is the types of variables that you have. So depending upon whether or not you have a qualitative data point or a quantitative data point, makes a difference in the statistical analysis that's going to be conducted on that data. If you have a yes, no, then you can, if it's possible to change it to a numeric may give you a little bit more variability in the data. So we may have a little bit more options, but there's a lot of times when that's just not possible. We have a lot of data that is in the health records that are qualitative. And so we just have to look at what variables we're pulling and figure out what is the best statistical model to be able to analyze the data. I've done logistic regression analysis with the data points that are binary. I've done with survival analysis. There are a lot of different things that can be done. Fisher's exact test, t-test, ANOVAs. I mean, there's a variety of things, but at the same time, you have to know what your variable is. And then once you are identify that, then we can use that information to also then put in our statistical analysis plan, how we're planning on analyzing that data. And then our last step is the, for the analysis plan is the preliminary analysis, which is going to include our table 1. And Monica's going to talk about that one in a minute. And then all the different types of information, like how are we going to handle missing data? Now, before I started working at Carillion, I taught statistics for a little while. And when you teach statistics, you're explaining all these wonderful things about how, you know, you use this test and you do this. And then you get to real world data that has literally a lot of missing information or messy information, as I say. And so because of that, there's a lot of things that have to be discussed. You know, are we going to try to impute data? Sometimes that's helpful, but sometimes it's not. Sometimes it may give you information that's not going to be applicable or representative of your population. And so it's very important to make sure that we talk about, like, what does this mean, or how are we going to address this? And then the analysis by aim. So if you have your specific, your first aim, your primary aim of the study, and then any other secondary aims, we talk about putting in that plan. What is our statistical technique that we're planning on doing? Because as Monica said, if someone else needs to help take over, then they would be someone already knows kind of like what our plan was from the very beginning. And that's the different stages of this analysis plan that we needed to try to help build.
Yeah, and so now I'm going to talk a little bit about why we should visualize the data and why it's so important. And I think this step can also sometimes be perceived as like a roadblock to the finished result, but it's very important to do it because of the examples I'll talk about. So the first thing visualizing data can do is reveal a really obvious error in your data. So for this data point, it's clearly, you know, in this simple example, X and Y are clearly very linearly related, but then there's this one guy who's confused. And so we would say, hey, this doesn't look right to us. Do you want to check to make sure there wasn't a clerical error? Do you want to check to make sure, like, is this even biologically possible, etc.? And then we can resolve a lot of those issues just because we took a second to look and get our eyes on the data. And then the other thing, if you think back to, I assume, a statistics class you took at some point before you started working, we use a lot of t-tests and other methods that depend on our data being normally distributed. And if it's not normally distributed, the inferences we make or the conclusions we make might be misleading or just wrong. So that's another reason we look at the data, we get our eyes on it and say, oh, hey, this is really right skewed. So maybe we need to think of a different method than, you know, a t-test. This might be a Wilcoxon rank sum test, which is very similar to a t-test, but does not assume normality. So then we can kind of get around the asymmetric data problem that we have in this example. And then the second thing that we do right after your data is collected is we like to characterize the sample, especially in human data research, right? In statistics, if we get a representative sample of our whole population, then in theory, we can make inferences or statements about that whole population. But we don't know exactly what population we sampled from if we don't characterize who it is, who's in our study. So this is hypothetical data that I actually randomly generated for a course, and it works really well here as well. So in this fake study that I created, we can see that average age is 46 with a standard deviation of 7 or 8. So that means our age is ranging between like 30 and whatever 46 plus 12 or plus 14 is 60. So then we know that, you know, this study might generalize to that age range, whereas it might not generalize to 18-year-olds or to 90-year-olds, right? And, similarly with the location, like where do these people live? Does this only apply to people living in urban areas, or does it apply to kind of everyone? And so on. So this gives us one, a good idea of what we're dealing with, and two, publications love these table ones so that you can tell your reader exactly who you studied, so that your reader doesn't, take a study that was done on young people and apply it to old people, or, any other example you could think of there.
Yeah, so for the data cleaning pieces of this, as we pull data out, it goes back to the conversation of the imputation that we talked about a little bit earlier, and whether or not, how are we going to handle missing data? I worked on a project where they had a survey analysis, and they had conducted a survey on a set of people, and it was not a survey that was created by Carillion. It was like already a set survey. And I can't remember what it was about, but there was a scale on it of, like, let's say 1 to 10. And some of the paper that someone had used to kind of like help support this concept or this particular project at Carillion, they had imputed some values. And within the scale, when you impute, a lot of times you impute with an average value of something. But what happens is, in that particular scale, if you ended up like 1 to 4 was something, and then 5 to 6 was something else, and let's say 7 to 10 was something else. So then they categorize them into 3 different categories. Well, a change of one value put them into a different category. So there's a whole there's a lot of questions. Then should we actually say that someone is this, if we're going to classify them in terms of that based off of an imputed value? So there's some questions that come in as to what's the right way of handling this, what's the best way of handling it. And nothing is necessarily 100%. We definitely should do it this way, or we definitely should do it that way. It's really about the data, what we're trying to say with the data, and how confident we can be with what we're doing. And so there's a lot of discussions that have to happen, especially when we're also extracting data from Epic, because again, you have to be very specific in the data that you want. If you want blood pressure to be extracted from Epic, there's a lot of blood pressure values for one patient. So which blood pressure do you want? Do you want an average blood pressure? Does that make sense? Do you want the first blood pressure since they came to the ED? Do you want the blood pressure when they left? Do you want to see a difference in the blood pressure? I mean, there's a lot of things that have to happen in a discussion, because when we extract it, there's very specific things that we have to think about, especially when we're trying to pull data. And then there's also time features. When you're trying to pull data, someone wants BMI over a patient that came in and wanted to do like a hip surgery. Well, if you want BMI for that patient, what BMI do you want? Maybe they've seen a doctor, over the last year, and do you want a BMI that's the closest to the surgery? Do you want the BMI that was before or after? And sometimes there might not, maybe that BMI is over 4 months old or 6 months old. There's a lot of things that have to be discussed when we're talking about data extraction. And as we extract it, then we look at it like Monica was just sharing with you, and we say, is this reasonable? Did someone accidentally type this number in wrong? Those types of things. Same thing with data collection tools and surveys. And then we have groups of people that have to do chart reviews, because there are some data points that are not in the Epic that can be pulled from the database. They may be in notes where someone has jotted down some information, and if that data lives in notes, then it is not going to be extractable at this particular point. We're working on some of those things, but that's just a very hard concept, because it's not even built into the Epic that we would have access to in terms of like pulling that data. So there's some things that we have to be mindful of. Also, Epic came online at Carillion in 2008 or 2009. Well, there are certain data points that weren't even pulled into Epic until, let's say, 2016 or 2014. So if we didn't have it before 2014 and you want to pull that, then we're going to have to tell you that your date range is going to have to change. Those types of things. So data management tools that we have at Carillion is, again, I mentioned the red cap, where we can put, a lot of times we will build a red cap for you that will allow you to put in all the basic information that we can maybe pull from Epic that will live in the REDCap, but maybe you're doing something where you want someone to take a survey, or you're doing something more prospectively and you're waiting for data to be entered later. Well, we keep it all in one place in REDCap. You go in and enter that data, and then we can extract all of that out later to analyze it. But it's already built into a secure environment that only people who have REDCap access can do, or can get into. Shared drives, we use at Carillion to store data, same idea, but a lot of times in the shared drive, it's going to be maybe an Excel file or 2 or 3. And so when you do that, there is a tendency for someone to accidentally write over an Excel file, or we have had it happen before where someone decided to move a shared drive folder to another location, and then it's gone. And all of the data in it is gone. And TSG will help you try to look for it. But if they can't find it, or if you didn't realize it had moved recently, then the backup that they have for the shared drive is not going to find it. So there's a lot of information with shared drives that can be useful, but we just have to be very careful of how we use it. And then a secure cloud-based storage, that's our Spark environment. And we've had a lot of people that have reached out to us to ask us to help with that they want to like do some analysis. I know our School of Medicine students are asked to do a lot of the analysis themselves, or to get maybe some support on it, but they want them to really understand what they're doing when they're analyzing the data. So we have that available where collaborators can go in together, look at the data, use the tools that are built into the secure environment, and then actually the data is living there along with the statistical analysis platforms that will help you hopefully analyze the data, or that we can help you analyze the data with. So that's also another really nice feature that we have available. And we have a lot of VT people that are on those secure environments as well. So it's not like it has to be a Carillion person only. We are opening it up so that we can have a lot of different people come in and work on the data that's listed in there. Our data analysis will follow the guidelines from the IRB protocol, the statistical analysis plan, and client discussion. So as we go through, we really do talk about all those things with you and try to make sure that we follow those. And it's important to, like, we are not in competition with one another as statistical people. We are trying to do our best to get you the right information and to also analyze data. And it could be that we see things differently. It also could be that we think about different things because maybe we have an experience using one particular method, maybe more so than another method, or something along those lines. But it's important that you know that our goal is the same thing, which is to take your project, get the research question answered, and help you move forward in that process. But we also need to follow the IRB protocols. Or the NIH grant information that you're going to be submitting. But if you are, there are times when we have to say, okay, if you want to do that change, then that's going to require an IRB amendment, because we just can't all of a sudden decide, okay, we're going to give you a different 2 or 3 different data points that you didn't even officially ask for. So we have to be very careful where that's concerned. And then we have all the different data analysis methods that we've mentioned. There's a lot of different things, but that I know that the skewed data set that Monica talked about earlier, I tell people all the time, never would have thought about length of stay in a hospital being so right skewed, but it's one of our biggest ones that is. And a lot of times people want to know something along those lines or how to analyze that. So we go through a lot of different methods to try to help answer those different questions, but it really does take someone with some statistical background to help address some of those questions. And that's the reason why we're here, is to hopefully help you see that we are going to be a benefit to you in the process from the beginning to the end, hopefully.
Yeah. Thank you for saying all of that. I agree 100%, Tonja. We're not in competition, and we're all just doing the best we can and with what we think is best. Yeah. So the final stage is revisions of the statistical analysis and then finalization, writing a manuscript or preparing a poster. Both groups, I think, are very able and willing to help with any manuscript writing. So if we did your analysis, we can actually write the statistical methods section of your paper on your behalf. And then, of course, hope that you would consider us as co-authors when appropriate. And there's a link here. Hopefully we can get that out to you. That has like very specific kind of like guidelines on who should be an author and like what place in authorship they should get. What else we add? Yes, we add tables and figures and graphs to your poster or manuscript. Those can be very time consuming to create if you don't have statistical expertise. So hopefully we would be able to like get those things out and get them perfect for you a lot quicker than it might be if you had to do it yourself. And then, yeah, assistance with statistical formatting. How exactly do you write about your statistical methods? How do you write equations if you need them? What's the best way to display things? We can deal with that as well. I think that's all we have for you. Thank you all for coming and listening, and we can take any questions. I think there might be some in the chat.
Let's see if there's anything in the chat. Heather posts lots of links as they're being discussed, and Deb posts things about CME and such. So that may be what you've been seeing. I don't see any in the chat. But if you would like to ask any questions or make any comments, please feel free to unmute yourself and or put your video on. Lots of great information. Thank you all so much. Lots to digest.
We did get one question in the chat about fees or charges associated with services. And it's very different between the two groups. So I'll answer first and then Tonja, you can go after me. So here at, I forgot where I work for a second, at Tech, at the Center for Biostatistics, our walk-in hours are completely free of charge. So if you want that level of help where we can just answer questions, maybe guide you a little bit, but we never really like have our hands on your data and do any analyses ourselves, that's completely free. And we really love when we see collaborators come and ask questions. So that's an option. But then if you do want a longer term working arrangement, there is a charge associated with it. There's an associated charge. How about that? We have hourly options where you can say, we'll have an initial consult and then we'll come up with a scope of work and tell you how many hours that would take and then discuss a price. Or if you do write an NIH grant, we always ask to be added to the budget on that grant so that we can help you a lot more and kind of fund both my salary and, help your grant be better and have a stronger score because we're on there.
Yeah, I would say so because HEART is slightly different, we do have projects that are grant funded. We have projects that are funded through other like departments that provide some money for it. But we also are employed by Carillion. And so because of that, we actually support the whole entire HEART process supports QA/QI projects that are not usually funded. We support other projects that are not funded. And so because of that, again, I said, I am allowed to see the data because it's my job. It's a part of what I do. So I can pull data or someone else in my team can pull data, and then we can make that data set de-identified if you need it for your project to be de-identified. But in the process of doing those things, a lot of that is not funded. And so we end up working on projects that not necessarily, we have NIH grant funding projects as well, but if it has something to do with the data at Carillion and with something that would be personally associated with our jobs, then that a lot of times is also non-funded. So we work with nurses. I've worked with a lot of people that have done their DNPs. I've worked with a lot of physicians over the years as well. So there's a lot of different projects and different processes that we go through. But if you're writing a grant and you're trying to apply it, we do have a fee that's associated with the statistical analysis, and that we can get that from my director, Maddie.
That's a great question. Sorry, I missed that, Roger. It looks like Benga might have a question.
Yes, indeed. So I wanted to first say thank you so much. Very thorough, very helpful. Very rarely do I make notes, but I actually did make notes, so thank you. And I actually have 3 questions, which are probably all the same. The first is, would you mind sort of emailing us the sort of virtual walk-in offices that you guys have? The Zoom ones may be particularly helpful. Sometimes hard to get to Riverside 4. The second sort of thing was, you guys already mentioned that the IRB does, Carilion IRB does require a statement from a biostatistician when you're making your submission. For some people who have research experience, they may not need, they may not reach out to a biostatistician early. What's the best way to go about obtaining that? I've heard that sometimes a ticket can be entered, and I wondered if that's the best way. And when they say a ticket can be entered, what do they mean a ticket can be entered?
Well, I'll answer the question about the ticket, and I'm sure we'll be happy to send to you the emails with the links on it for the various drop-in hours that we have. But I've had people actually, so I'll use that as a segue too. When people have dropped into my office hours, and it's not just we share the office hours with different people on my team. But when people have dropped in, sometimes they'll drop in and ask questions about the statistical analysis for their particular project. We'll discuss it. And we talk about like what it is that they're looking for. I'll explain what that is. And then I sometimes will write like a little small paragraph that just says, this is what they're trying to analyze. This is what they're trying to do. It may be longer than that. It just depends. And then I can email it to them, and then they can put that into their project. And then they can put my name on there, because there's a little place for you to put a name. It's just so that they know that you've talked with someone that is a statistician. Same thing. If you were to talk with Monica, you could put Monica's name in there, and then that would be the same situation. The ticket that they're referring to is probably an Edison ticket, but you don't have to do it yourself. You can contact Hart and tell them that you're interested in working with someone to get that information for your IRB, your statistical support. And if you can't do the drop-in hours, then we will reach back out to you and come up with a time to specifically meet with you one-on-one, virtually, more than likely, to be able to answer the questions and do the same type of thing we would during our drop-in time, and then be able to still provide that information. We get a ticket, like Carilion Hart will create a ticket for me that say, I'm going to work on that particular project with you, but you don't necessarily have to create it yourself. That's how I'm interpreting your question.
Thank you very much.
And if you would like, yes, my kind of eyes, or the Center for Biostatistics eyes on your IRB application and your statistical methods, you can come to our drop-in hours. That's a very good use of those. I think we have questions in the chat. Are you open to seeing faculty that are other affiliations such as BA? Yes, we actually have 2 pretty long-standing collaborators here at the Center for Biostatistics that are at Salem VA.
Yeah.
And then
I would say the same thing. My answer would be yes, I'm sure we would. I will also say that a lot of the projects that we work on are connected with either Carilion data, Carilion physicians, or somebody. There's usually a Carilion connection as well. But we're happy to talk to you about what you're working on, if that's something that we can be of benefit to.
Great. There's one more in the chat. I don't know if you mentioned this, you may have alluded to this. Are there charges altered or waived if somebody from your team becomes authors on the project? That's a good-
Unfortunately, they are not. So just keep in mind that my salary comes only from grants or, these hourly kind of jobs that we take. So if we just stop taking fees, none of us would make money, and therefore kind of we don't make a living anymore. So we have to kind of have a hard and fast rule there. But definitely if you have questions and you want to like talk through things, the walk-in hours are a really great time. You can give more specific examples to your research project, and we can give you kind of a better idea of what those like fees associated might be.
Great. And then we have a question in the chat, Anthony Bacobani.
Hi, so my question is, do you do these presentations? Let's say we have a weekly ID conference and, we have like a 1-hour slot. Do you sometimes, if I were to invite you to come and do something similar, focused on the ID department, is that a thing you guys do?
Well, I would say that I've helped give information or discussions to other departments for residents and fellows for statistical discussions. But I don't want to speak for Monica, but I would have no problem in sharing this information with you if you wanted to, have us come and present some information for you about statistics.
Yeah, and it's probably my biggest passion about being a statistician is like teaching others about why we're important, because it's lost kind of in interpretation when you go through medical school or getting a PhD or whatever, education you have. So if you want to reach out to the Center for Biostatistics, we'd love to do any outreach like that and come teach or inform you like everything we have to offer. Yeah.
Excellent.
You can either contact them directly or go through our office, Anthony, and we will put you in contact with them. We also, it's probably a less appealing option, but we do videotape all of our sessions and they're posted online. So if anybody wants to show this presentation and then have discussions, start, have discussions within their group, that's fine also. But if they're willing to do so, I think that's probably the number one option.
I think we'll take all of the above. So I'll reach out. Yeah, thank you.
Okay. All right, well, you have their contact information and you have our contact information. You have lots of contact information. So if you have any questions, concerns, comments after this session, feel free to contact any of us and we will be happy to hunt down your answers if we don't have them immediately. But have a great rest of the day. Try to get out there, breathe deeply in some of this beautiful air and weather, and have a great rest of the day.